Hi and welcome back to another video of Medic Notes. This video is on meniscal tears. Meniscal tears are common sports-related injuries in young athletes, and can also present as a degenerative condition in older patients. Diagnosis can be suspected clinically with joint line tenderness and a positive McMurray's test, and can be confirmed with MRI studies. Treatment can be non-operative versus operative, depending on the morphology of the meniscus tear, root involvement, patient symptoms, and patient activity demands. For epidemiology, meniscal tears are very common, and is the most common indication for knee surgery. The risk factor is ACL-deficient knees. Medial tears are generally more common than lateral tears, except in acute ACL tear cases, lateral tear is more common. Meniscal tears can be classified through its location, red, red-white, or white zone. Position, whether anterior, middle, posterior third or root, and its size. Other classification include its pattern, whether vertical or longitudinal, bucket handle, oblique, flap, or parrot beak, radial, horizontal, complex, and root pattern. For its symptoms, patients complained of pain localizing to medial or lateral side. Mechanical symptoms like locking and clicking, especially with squatting, and delayed or intermittent swelling might be felt. On physical exam, joint line tenderness is the most sensitive physical examination finding. Effusion may be present. Provocative tests include the Apley compression Thessaly test. By standing at 20 degrees of knee flexion on the affected limb, the patient twists with knee external and internal rotation, with positive test being discomfort or clicking. And McMurray's test. Flex the knee and place a hand on medial side of knee, externally rotate the leg and bring the knee into extension. A palpable pop or click plus pain is a positive test and can correlate with a medial meniscus tear. For imaging, radiographs should be normal in young patients with an acute meniscal injury. Meniscal calcifications may be seen in crystalline arthropathy. MRI is the most sensitive diagnostic test for meniscal tear. MRI grade 3 signal is indicative of a tear. Other findings include a linear high signal that extends to either superior or inferior surface of the meniscus. Parameniscal cyst indicates the presence of a meniscal tear. Bucket handle meniscal tears indicated by double PCL sign and double anterior horn sign. Meniscal extrusion or ghost sign may indicate meniscal root tear. The first picture shows the double PCL sign. Second picture shows the double anterior horn sign. For treatment, conservative is indicated as first-line treatment for degenerative tears, which include rest, NSAIDs, and rehabilitation. Whereas for operative treatment, partial meniscectomy, done when tears not amenable to repair, such as complex, degenerative, or radial tear patterns. And if repair failure more than 2 times. Meniscal repair, indicated in meniscal tears which are peripheral in the red-red zone. Lower rim width correlates with the ability of a meniscal repair to heal. Vertical and longitudinal tear, 1 to 4 centimeters in length. Root tear, and acute repair combined with ACL reconstruction. Next, for meniscal transplantation, this procedure is controversial, and for young patients with near-total meniscectomy, especially lateral. Another rare surgical procedure is total meniscectomy. For complications of meniscal tears, there are saphenous neuropathy, arthrofibrosis, sterile effusion, perineal neuropathy, superficial and deep infection. That's all for this video. Thank you.